There's no doubt that Australia has done well at keeping the COVID numbers down, and that has come at a huge cost with lockdowns, particularly in states like Victoria. But now, as we stand now, with the vaccination rates behind schedule, we're at around 8% of the population now being fully vaccinated, and the Delta variant spreading. Have we squandered the advantage that we had?
Well, good morning, Joe and Fazia. And unfortunately, yes, is the short answer. I think we've had a tremendous opportunity over the past year in particular, after we've seen the numbers of COVID go down to extraordinarily low levels, and that's through everybody's hard work and compliance with public health orders. And it's been fantastic to see the level of public engagement with those requirements. The problem that we've had, though, unfortunately, it seems, is that we haven't really prepared for what comes next particularly well. And we haven't thought about how we're actually going to make that roadmap to recovery. The focus is very much obviously on the vaccine rollout. And we really need to have used the time productively to think about all of these different stages. Many of the announcements that the Prime Minister made yesterday are yet to actually be finalised or agreed by state premiers. So there's still some possibility that we won't see that roadmap that was announced yesterday come to fruition.
Well, Adam, a number of years ago, you were appointed to the Council of Australian Government's Task Force for Testing and Revising Australia's Preparedness for a Pandemic and then how it might recover. What was clear to you then about how prepared or otherwise Australia was for a pandemic, and has what you expected played out in real life?
To a large degree, yes. And in 2008, Australia was actually world leading in our pandemic preparedness plans. We were actually, Exercise Sustain 08 was looking at how we would recover from a pandemic. And when we spoke with the World Health Organization, no one else had actually undertaken that sort of analysis. So we were actually world leading at that point. We've seen since that time that no further planning has really been conducted, particularly on a national scale. We've seen states undertake sort of minor or smaller sort of coordination exercises, but we've kind of lost that opportunity to stay prepared. And we know, or at least the messages that I was hearing from various state and territory authorities was that our national medical stockpile had been depleted in the lead up to COVID. So we've had an opportunity there. We need to sort of get back and actually make sure that we are really well prepared again for the next pandemic.
How did we compare to other countries? And if we have a look at how other countries have dealt with this pandemic, are there any lessons that we can learn from any other countries?
I think there's probably multiple lessons that are yet to be fully sort of captured and integrated, really. First and foremost, though, is that technical capacity by itself is not a sufficient measure of preparedness. We know this, obviously, in looking at countries like the United States that had been identified and listed as number one for the world's preparedness. And the focus on just technical capacity really indicated that that is insufficient. So we need to think much more holistically, much more multi-sectorally than what we've currently been doing. And that applies for both the response phase as well as then the recovery. And I mean, we obviously know that vaccinations are critical to that process. We also know that from the actions of other states around the world that lockdowns do have a general utility. We've seen border closures internationally prove successful in curtailing the virus. So these are measures that we're likely to see again in the future be rolled out when we see new disease outbreaks. But also, obviously, there is a threshold for all of these types of measures as to when they're going to be most effective and when they're really needed.
So yesterday we had these 4 phases outlined by the Prime Minister of Australia's path out of the pandemic. And it seems as though, at least initially, there'll be different rules for people who are vaccinated compared to people who aren't vaccinated when it comes to travel. Do you think that there will be some sort of a vaccination certificate or passport used in the countries, used around the world, and Australia included, as we reopen borders?
Well, a vaccination passport around the world is quite the ask at the moment. What we're sort of seeing happen, obviously, in Europe launched their EU digital certificate just in this week. But that is being progressively rolled out over a 6-week period in the EU. We've seen, though, that it also is controversial in a number of ways, and particularly, so the vaccination passport or the certificate allows for 3 categories of people: people who have received the vaccination, people who have received a negative test result, or people who have recovered from COVID-19. Now, that also leaves out, though, another category of people who are unable to be vaccinated due to medical reasons. And there's always a small proportion of people. And so there are some concerns, and they're very legitimate concerns, about the discriminatory nature that such sort of vaccine passports may generate. But of course, on the other side of that, we want to see people being able to start to return to their lives as they were, being able to travel internationally to see family and friends, and start to move around as we previously did. So there is a balance to be struck here, and it's going to be really quite important and critical to have those conversations, not only nationally, how we're going to approach this, but also then internationally and how we coordinate with other countries.
Yeah, I'm sure those conversations will be happening a lot over the next couple of years. Adam Kamradt-Scott, it's great to have you on the program this morning. Thank you.
Thanks for having me.